Hello, my name is Dr. Wes Allison here at Advanced ENT and Allergy. Each week we take your questions and do our best to answer them for you. Today we are talking about imbalance in the elderly patient population as well as tonsil stones and how the winter can affect the allergy season.
My mother is 80 years old and having difficulty with balance, and I read an article about vestibular disorders. Would it be wise to have my mother checked out by an ENT physician?
Yes, I do think it would be a great idea for your mother to come in and be evaluated by an ENT physician. Most often in the patient population that is more experienced, imbalance can be related to multiple factors, things such as vision, spine and joint problems, blood pressure problems, even heart-related conditions, neurologic conditions, even medication side effects can all contribute to a sense of imbalance. But of course, the ear and inner ear can definitely be involved with imbalance as well, and that's where we come in. So what's involved with an evaluation by an ENT physician? Well, first we would want to get a better idea just with a good history of, are these symptoms related in any way to a true sense of vertigo or spinning or motion sensation, or is this just strictly a generalized imbalance or a sense of disequilibrium while standing? But also important is a good physical examination. We can rule out fluid in the middle ear or middle ear infection. But there is also a very common condition of vertigo called benign positional vertigo that we can diagnose very quickly here in office, but even treat it here in office while you're here. Finally, very important with our examination evaluation is a hearing test. There are some patterns of hearing loss that tip us off to the need for even imaging, such as an MRI. But even screening for severe hearing loss is very important, as there have been recent studies showing that hearing aids even will help patients with imbalance and even help to manage dementia or even prevent dementia. Here at Advanced ENT and Allergy, we have a wonderful staff of audiologists that are also happy to help in fitting these hearing aids if they are necessary.
I have tonsil stones that pop out a lot and gag me. I read that a laser can be used in that area to help remove the pockets. What are my options for relief?
So tonsil stones are a subject that's near and dear to my heart because I myself am a sufferer but survivor of tonsil stones. So tonsil stones are collections of concentrated mucus, dead cells, food particles, and bacteria that can collect in small holes in the tonsils called crypts. They're quite bothersome, little white, mushy, smelly objects that can cause bad breath, can also cause chronic sore throats. I'd like to give you an idea of what these crypts in the tonsils look like. So if you'll look closely, I'll show you a look at my tonsils. Hopefully you've had your breakfast or lunch. Translation, I think you get the idea. So what I found success with my tonsil stones is antiseptic gargles or using peroxide or salt water several times daily, at least in the morning, at night before bed, and even after meals, and that helps to prevent these stones. Even so, every 2 to 3 weeks, my children or my wife, in the nicest possible way, will let me know that it's about time to do something about these stones. And what I've had success with is just gently with a clean finger in front of a mirror and with a light, massaging these stones out of my tonsils. You can also use a Q-tip, even a water pick, that is also beneficial to actually manually extract these stones. Ultimately, the only surefire way to get rid of tonsil stones is actually to perform a tonsillectomy, or at least a partial tonsillectomy. The problem with this procedure, it's just very, very painful and really not something we commonly recommend for tonsil stones. There are newer techniques out nowadays, one of which is lasering these holes in the tonsils. And the idea is to burn the center of these holes to where they actually close or fuse. And thereby there's no space for these tonsil stones to develop. The problem with these procedures is that these holes or crypts often recur, but then there are simply just so many of these crypts in the tonsils at times that it's just unreasonable to laser each and every one of them. And logistically, there are really only a handful of ENT physicians in the country that perform this procedure, and none in this area that I am aware of. Really, insurances do not cover this procedure, as they do feel it is still experimental, so it can be quite expensive.
I've heard this allergy season could be the worst we've ever had. Does the winter have an impact on how bad spring allergies will be?
So winter definitely affects the allergy seasons, both in the spring and in the fall. So in the fall, ragweed season begins usually in mid to late August and continues essentially until there is the first frost or the first freeze. So it can definitely determine how long our fall ragweed season is. And then in the spring, same concept. With a mild and wet winter such as we're having now, it definitely will lengthen the allergy season. So you may have to pull out your antihistamines and sprays a little earlier and use them longer through the season. Now the flip side of that, unfortunately, is that even with a late frost, it usually means that the pollination is almost reset in a way, and so there is a higher percentage of trees pollinating all at once. So even though the season is shorter, it could be a little bit more intense in those few weeks after that frost. Unfortunately, here in the Iowa River Valley, it's always a bad allergy season. But there's hope for you. Our doors are always open here at Advanced ENT. We have a lot of good physicians ready to help you through spring, fall allergies, whatever it may be.